The Michigan Alcoholism Screening Test. The Michigan Alcoholism Screening Test was developed and published by Professor Melvin L. Seltzer in 1971. It is a 24-item instrument designed to detect alcoholism. It was developed to be used with the general population and is most frequently used with adolescents and adults. It is administered in an interview format or self-administered through pencil and paper by the respondent. It takes 15 minutes to administer and score, and the instrument can be accessed online. Alcoholism or alcohol use disorder is when one can no longer control their use of alcohol and compulsively abuse alcohol despite its negative ramifications, and or experience emotional distress when they are not drinking. It is a chronic, relapsing disease that is diagnosed based on an individual meeting certain criteria outlined by the DSM-5. The DSM-5 considers alcohol use disorder a problem of alcohol use leading to clinically significant impairment or distress as manifested by at least 2 of the 11 criteria symptoms occurring within a 12-month period. These symptoms can be found on page 490 of the DSM-5. Items. The items on the mask were selected after review of several other approaches to investigating alcohol abuse, and they describe symptoms of excessive drinking, various problems in the area of social, family, work, legal, and health that an individual may have encountered as a result of drinking, concerns expressed by others about an individual's drinking, and efforts that an individual may have made to control drinking or seek treatment for excessive drinking. Scoring. Questions are answered with yes or no, and they carry weights of 1, 2, or 5. The point weights are listed on the instrument. For items 1, 4, 6, and 7, an answer of no will be awarded the relevant number of points, whilst for questions 2, 3, and 5, and 9 to 22, an answer of yes will be awarded points. Items 23 and 24 ask about the number of arrests. In this case, this number is to be multiplied by 3. Scores of 0 to 3 indicate no apparent alcoholism problems. Score of 4 indicate early or middle alcoholism. Score of 5 to 49 or above indicate aggravated alcoholism diagnosis. This is an example of the Michigan Alcohol Screening Test, and as you can see on the right-hand side, you can find the point values associated with each question. Reliability. The long and short forms of the mask have excellent internal consistencies. This means the items on the mask measure the same construct well each time. No data of stability were reported. Validity. The mask has excellent known groups validity, being able to classify most respondents as alcoholic or non-alcoholic. Even when respondents were instructed in advance to lie about their drinking problems, the mask correctly identified 92% of 99 hospitalized alcoholics as having severe alcoholic problems. Research. The mask is one of the most widely used measures for assessing alcohol abuse. It is one of the oldest and most accurate alcohol screening tests available. It has good psychometric properties. It can effectively identify individuals with alcohol-related diagnoses. However, the mask results should be confirmed by other assessment means. There are also shorter versions available, such as the MASG used for geriatric population and the shorter 13-items mask. There are some drawbacks, however. The length of the test makes it less convenient to administer in a busy emergency room setting compared to the shorter 4 or 5 question tests available. The questions on the mask test also focus on problems over the patient's lifetime rather than on current problems, making it less likely to detect alcohol problems in the early stages. And it does not address substance abuse problems other than alcohol. There are some alternatives to the mask as well. The Alcohol Use Disorders Identification Test, the Alcohol Use Inventory, the Substance Abuse Subtle Screening Inventory 4th edition, the Addiction Severity Index, and the Comprehensive Drinker Profile. These are the references used in the presentation. Does anyone have any questions?